Welcome to Body Talks Health, where we explore the complex mechanics of the human body and how to protect it. Today we dive deep into the cervical spine, understanding how neck injuries happen and the science behind disc herniation. The cervical spine consists of 7 specialized vertebrae, stacked vertically, forming a strong protective canal for the delicate spinal cord. These bony structures are the primary defense system, shielding the vital neural pathways that connect your brain to the body. Situated between these rigid vertebrae are the intervertebral discs, essential structures that act as shock absorbers for daily neck movements. Each disc is a complex marvel, composed of 2 distinct parts, a tough outer layer and a soft inner core. The outer layer, called the annulus fibrosus, is a sturdy ring of fibrous cartilage designed to contain the internal pressure. Deep inside lies the nucleus pulposus, a gel-like substance that distributes hydraulic pressure evenly whenever your spine bears any load. While this system is incredibly resilient, sudden forces or chronic stress can compromise the structural integrity of these shock absorbers. A common injury mechanism is hyperflexion, often seen in car accidents, where the head is violently thrown forward and down. During this rapid motion, extreme pressure builds up at the front of the vertebrae, squeezing the disc backwards with force. The soft nucleus pulposus is pushed forcefully against the posterior wall of the annulus, stressing the fibers beyond their limit. Under this immense hydraulic pressure, the tough outer layers begin to thin out, weaken, and eventually develop small microscopic tears. This damage does not always happen instantly. It can accumulate over time, leading to significant structural changes within the disc. Depending on the severity of the damage, the injury typically progresses into one of 2 painful conditions affecting the nerves. The first stage is known as a bulging disc, where the nucleus pushes the weakened outer wall outward without rupturing. The disc loses its normal shape, expanding into the spinal canal where there is very limited space for extra tissue. This protrusion presses directly against the spinal cord or nerve roots, triggering an inflammatory response in the surrounding sensitive tissues. Patients often experience localized pain, stiffness, and inflammation in the neck area as the body reacts to this structural intrusion. If the outer wall is too weak to contain the pressure, the condition advances to a more severe herniated disc. In a herniated disc, the annulus fibrosus tears completely, allowing the gel-like nucleus to leak out into the spinal canal. This leaked material is chemically irritating to the nerves and physically compresses them much more severely than a simple bulge. The compression interrupts nerve signals, often causing numbness, tingling, or profound weakness traveling down the arm and into the hand. While a bulge is a distortion of the container, a herniation is a breach of the container itself, causing leakage. Fortunately, most disc injuries heal with conservative care, starting with rest and anti-inflammatory medications to reduce the immediate swelling. Applying heat or cold packs can help manage pain, while physical therapy is crucial for strengthening the neck muscles later. For persistent pain that does not respond to basic care, doctors may recommend epidural steroid injections to calm severe inflammation. In severe cases where motor function is compromised, surgical intervention may be required to remove the damaging portion of disc. Understanding your spine is the first step to recovery. With proper diagnosis and treatment, most people return to full activity. Thank you for watching this detailed medical breakdown. Subscribe to Body Talks Health for more insights into your body's mechanics.